I'm Deborah Krasaniak from the Cytotechnology program here at Old Dominion University. Our program is a very specialized laboratory profession in which we teach students to diagnose precancerous and cancerous lesions. Our program is very intensive and the technical year is approximately 12 months long. We are one of only 21 programs in the whole nation. In order to get into the program, you need 20 hours of biology, 8 hours of chemistry, and your general education requirements. At the end of this program, you will sit for a national board exam. The salaries in the field are approximately $60,000 to $70,000 to start. If you want to help people and you love science and you like looking under the microscope, then this is the profession for you.
So what I like about the field of cytotechnology is how flexible it is once you graduate. So you can go off to medical school and you can become a pathologist or a cytopathologist. But if you don't want to go off to medical school and you want to stay as a cytotech, you can go off and work at a private lab or you can work in a hospital.
You have classes 5 days a week and you have multiple exams for each week, which you will need to study for. You will also need to produce a portfolio, and this is including with taking clinicals.
Hello, my name is Brenda Bradshaw and I'm the entry-level program director for the School of Dental Hygiene. Our program offers baccalaureate, degree completion, and master's degree programs with state-of-the-art technologies and some of the nation's most prestigious faculty. Dental hygienists are prevention specialists who help patients avoid disease. Students in our program learn one-on-one with researchers and dental hygiene clinicians from our surrounding area. Before entering the program, students take prerequisites such as anatomy and physiology, chemistry, nutrition, and microbiology. Our student pass rates are 97% on certifying boards. Students learn such skills as local anesthesia, laser bacterial reduction therapy, and guided biofilm therapy. To be a successful dental hygienist, students need to have a desire to care for their patients' oral health and overall health and a willingness to work interprofessionally.
The things I like about the field are flexible hours, I get to help people, and opportunity for advancement.
Being a student in the program can be very hectic sometimes. It's overall a fulfilling experience, but you've got patients, you've got assignments, you've got tests. Sometimes you have multiples of those in one day, which is where your organization skills and your communication skills will come into play. You have to be able to think on your feet because sometimes things don't go the way you would want them to as they do in life. And you can't just give up. You have to keep pushing forward to reach success in this program.
A good hygienist is compassionate, stays on top of new skills, and is able to multitask.
Hi, my name is Jim Blando, and I'm an associate professor in the School of Community and Environmental Health. Our school deals with many diverse issues across the broad discipline of public health, everything from health promotion and healthy lifestyles to environmental and toxic exposures, on how to deal with and mitigate and improve the health of the public. Our field tends to utilize scientific courses and have a scientific background, which is very helpful for those practicing in our field. The jobs that many students will obtain will be jobs such as working for local or state health departments. In some cases, we have many students who will work for corporate entities in their health promotion or industrial hygiene and safety departments. These jobs tend to produce very well-paying jobs, and many of our students have a job within a short period after graduation.
To be a successful student in the environmental health program, I feel that students need to be passionate, they need to be empathetic, and they need to have a love of science and math.
One of the things I like about the environmental health field is the safety aspect, because I believe that in any workplace, in order to be productive, or anyone to be productive, safety is required. And also, I like the field because there's an emphasis on science. If you like science, you like the program.
To be successful in the environmental health field, it's passion and empathy. To be good in this, you have to really truly care about the people, but you also have to be very calm and assertive, because there are going to be a lot of times that you have to convince people to do something they don't necessarily want to do for their good.
Dr. Luisa Lucero, a faculty member in Health Services Administration. Healthcare administrators play an increasingly important role in this current environment. Although not as hands-on as nurses or physical therapists, healthcare administrators ensure that individuals receive high-quality care in a timely manner. There are several positions that one can pursue with a degree in Health Services Administration, such as hospital department manager, insurance company analyst, and government policymaker. Some of the courses that you may encounter during our program are health ethics, population health, and finance and budgeting. Our program provides students the information that will allow them to become entry-level health service administrators or prepare for graduate school by focusing on multidisciplinary approaches ranging from global health to epidemiology. If you're looking for a big picture role in healthcare, we may have the perfect program for you.
To be a student in the program is challenging and difficult because I had to be accustomed to working long hours on the computer from home. However, because it was an online class, there were some pros and cons. Some pros are if you have a busy work schedule, you can work either before or after your work shift, or if you cons were you don't have that full teaching experience in the classroom, like if you need help from the teacher, they're not exactly there in your bedroom, or you really can't form study groups with your other students. Overall, I did enjoy the program. It was challenging, but I learned a lot, and I really learned how to read, write, and research case studies. So I am more confident in my reading and writing skills.
To be a successful healthcare administrator, you want to be detail-oriented, have successful teamwork capabilities, and also be professional within the environment. You need to be able to have experience in coding, data collection, and be able to also work with other healthcare administrators.
What I really like about the field is I like getting out there and actually meeting people and educating them on how they can live healthier lives.
Hello, my name is Barbara Fry and I am the Program Director for Medical Laboratory Science at ODU. Medical laboratory scientists tirelessly work behind the scenes to provide the valuable data for the physician to make a diagnosis, prescribe medication, and predict the outcome of treatment. In hematology, we analyze cells to identify anemia or leukemia. In microbiology, we establish antibiotic susceptibility of bacterial pathogens. In clinical chemistry, we measure your glucose and cholesterol levels. And in blood bank, we prepare components for transfusion. Our graduate job placement rates are about 100% every year. There is a nationwide shortage of medical laboratory scientists, so you are guaranteed to find a fulfilling job.
Being a student in this program is honestly like drinking water out of a fire hydrant. It's a lot of information very fast, and you have to be very good with your time management skills, and that's what it is to be successful in this program.
Someone good in this field is meticulous. You have to be organized and almost somewhat of a perfectionist. It's extremely important to make sure you're doing things right the first time. Patients could really suffer, and it could be detrimental to their health if you make a mistake in the lab. So you have to really be paying attention and make sure that you're doing things correctly the first time.
Someone good for the field of medical laboratory science would have to be attentive because somebody's well-being depends on the quality of our result. They would have to be compassionate because behind every patient sample is a human being, and they would have to remain teachable because science and medicine is always evolving, and we have to be willing to evolve with it.
Hello, my name is Scott Sechrist, and I'm the director of the Nuclear Medicine Technology program here at Old Dominion University. If you're looking for a career that combines science, sophisticated imaging equipment, and patient care, nuclear medicine technology is the field for you. Nuclear medicine technologists are imaging specialists. The field combines chemistry, physics, mathematics, and technology along with radioactive materials to diagnose and treat disease. New radiopharmaceuticals for diagnostic and therapeutic purposes include cancer-detecting and cancer-killing agents, such as genetically engineered antibodies. By taking images that identify disease and track the success of treatments, we are on the forefront of modern clinical medicine.
The biggest skill you really need is pure passion.
You cannot survive in clinicals without finding a passion for this field. It does become your full-time job, and you deal with things more than just imaging a patient and getting the material in them. You deal with situations where patients come down unprepared or they're very fearful of what we're about to do, and you have to learn how to handle all that on top of everything else we're already doing.
A couple things I love about this field is that I can provide patient comfort. I can work with a great team of coworkers who are always going to be there to help support me and help me with different patients and cases. And the interesting studies I get to see every day.
The qualities that makes someone a good nuclear medicine technologist are ability to adapt to any situation, ability to keep your cool, ability to multitask, because you'll definitely have several different demands on you at one time, and attention to detail. You have to make sure that you're doing the right thing for the patient every time.
Hi, my name is Janice Hawkins, and I'm nursing faculty and the Chief Academic Advisor of the nursing program here at Old Dominion University. I personally have been a nurse for over 30 years, and I wouldn't trade anything for a career in nursing. In my opinion, nursing is the best major on campus. So if you're interested in nursing, you're really interested in a job that matters. Our graduates have 100% employability, they work all over the world, and they work in a variety of settings. But most importantly, they're able to help people and make a difference. And that to me is what's best about the career that I've had in nursing. To become a nurse, you have to work hard to get there. It's a hard major. It has a lot of science classes leading up to it. You have to make good grades in those classes because you'll have to compete to enter the program. But the students tell me all the hard work is really worth it. In the end, you'll graduate with a job that matters.
To be a student in the nursing program is very rewarding, but difficult at the same time. We are in classes most of the week, and then that's also mixed with the clinical setting where we go to hospitals and we follow around a nurse for either 6 or 12-hour shifts. And then we would be studying for a major test that we have next week, and that's a typical schedule for a lot of the nursing students in this program.
The reason why I like nursing is there are a variety of different places you can work. For example, you can work in the OR, you could work at a school, being a school nurse, you could do community health. There are a variety of job opportunities everywhere. Right now, there's a shortage of nurses. This means that you can get a job pretty much anywhere.
For someone to be good in the field of nursing, you need to be willing to participate as a member of the healthcare team. You might have the opportunity to participate in various exciting interventions as well. But the most important part is to have a heart for others, to see them live their highest degree of health and wellness.
I'm Dr. Jim Bellamy, Program Director for the Bachelor of Science in Public Health program. Public health is anything we do as a community to be a healthier community. Our work ranges from tracking infectious and chronic diseases to helping communities prepare for and recover from natural and man-made disasters. With the great diversity in public health practitioners can expect to work with local and state health departments, federal agencies, nonprofit organizations, and healthcare facilities. The starting pay is about $50,000 per year. The program consists of 28 credit hours of health sciences foundation courses, including physical and social sciences. There are 54 hours of major courses ranging from principles of environmental health sciences to social and behavioral aspects of public health. The program culminates with an internship.
Skills you need to be successful in the MPH program are definitely community engagement, so you need to be able to talk to people, think on your feet a little bit, but also know how to do the research. Ask questions of experts, because obviously you're going to be limited in what you know, and there's going to be somebody around you who's looking for kind of your expertise, so it's great to network. What I like about the field is that it's everything that all your senses, so see, smell, taste, touch, feel, when public health works, you're not aware of it. However, when there's an outbreak of something or there's something happening people aren't sure about, that's what I like to kind of investigate. So that's interesting to me because you can help people directly if there's an acute issue going on, or indirectly over time help in the long term